Hi, I would like to start by acknowledging the traditional custodians of the land in which we are meeting today, the Wurundjeri people of the Kulin Nation, and pay my respects to elders past and present and extend that respect to all Aboriginal and Torres Strait Islander people today. So today we're having a coffee catch up with Susanne Sofronoff, who is our manager for prevention and early intervention programs, and we're going to be talking about the importance of early detection and oral cancers. So welcome, Susanne, to
Thanks,
having
Sue.
a coffee catch up with me. I really appreciate your time. So I'm going to ask you question number one: why is early detection so important?
Thanks, Sue. In the context of oral cancer is now the 10th most common cancer in Victoria.
That's amazing.
Yep. And looking at 2020 data, there was 847 people diagnosed with oral cancer and 179 people sadly died.
In the 2020 year?
2020.
Gosh.
Yep. So we know that oral health professionals play an important role. They have a vital role in the early diagnosis of oral cancer. And that's no surprise to oral health professionals. They see patients, they can recognise oral cancer early and refer off. So their role is critical.
Yeah. Is other people's role in the broader context of health important as well? So do other people refer to us because they think somebody might have oral cancer? Is there a pathway for that?
Definitely, and we're working on that in our next phase of the program.
Excellent.
So we've started with oral health professionals because they are trained in recognising oral cancer but may not recognise the important role they have in the prevention of oral cancer. So we've looked at that, and it's important the systems are all in place so that those referrals can happen seamlessly. Then we're going to work with other health professionals, and then we'll look at the public, because there's no point raising awareness in the public and then find that there's an influx of people coming and the systems aren't set up and they're not ready for it. So that's phase one of the program, was looking at oral health professionals and upskilling them because of their important role in recognition.
Excellent. Okay, so what difference does a preventative approach have for the outcome for a patient?
Right, well, as I was just saying, oral health professionals are critical in this, and they can actually empower their patients by having conversations, evidence-based advice, and really that can have such a big impact on the outcome for the patient. So we know that there are particular groups in the population who are at higher risk. So we've got people who smoke or use tobacco products, people who drink excessive amounts of alcohol. People who do both of those together are at even greater risk of oral cancer. Yep. There's also people low income groups who may present at a late stage of diagnosis.
Right.
And we also know that Aboriginal and Torres Strait Islander people are twice as likely to develop an oral cancer than non-Aboriginal and Torres Strait Islander people.
Gosh, so that closing the gap work that we do around how do we actually get more, information and get greater access for Aboriginal and Torres Strait Islander people is extraordinarily
very
important.
Yes.
So we need to continue doing that.
Yes.
So can you talk me through some of the DHSV programs that have been having some serious impact in this space?
Yeah. So we've got Smoke-Free Smiles, and that's been really important with looking at smoking cessation and the clinician's role in that. So we developed a training program, and that's available online on the DHSV website. We developed that in partnership with Quit Victoria, with funding from DH and Department of Health, and in partnership with the Australian Dental Association.
Okay.
And what that does is it encourages clinicians who, when a patient presents and they have identified as being a smoker or using tobacco products, that they have a very quick, short, sharp conversation around smoking cessation and asking if they... So it's based on a 3-step model.
Right.
Ask, advise, help.
Yep.
We've called it Just Say and it's ask the patient if they smoke, offer advice, and then help the patient to refer to the quit line where the specialists are there to really, help a patient quit, because you have several quit attempts before actually do. And this can make a huge difference in the outcome of a patient in the sense of oral cancer being such a high risk factor for oral cancer. So there's that program, and then we've also been funded by the department to roll out the oral cancer screening and prevention program. Now we're doing that in 2 phases. The first phase has been looking, as I said, focusing on oral health professionals, ensuring that anyone who's referred in, there's clear pathways and clinicians are looking for oral cancer. We've done that by producing a oral cancer learning hub that's online as well. It gives clinicians the tools, and it's evidence-based, and it's got everything there that they would need.
And didn't we win an award for that?
We did. So yes,
Well
we
done.
did. That was good. And then the second phase is with other health professionals.
Right. So who would we target first when it comes to other health professionals? Have we thought about the groups that we might
Yes.
give us the biggest bang for our buck, for want of a better word?
Definitely. We're going to start off trying to work with general practitioners. That's going to be tough in a pandemic, and as in the media at the moment, you know, that's not going to be easy, but that is where people go first.
Yeah.
The fact that it's covered by Medicare, visit to the doctor, that's where a lot of patients will present. So it's important that doctors know what to look for.
Yeah.
We know we've had advice that perhaps when it comes to anything in the mouth, that they don't see it as their domain.
Yeah.
So it's really around what they might need and identifying what that is, developing that.
Yeah.
So I'm thinking it'd be some sort of training and supporting tools, evidence-based materials. We have a new program lead who's just joined DHSV, who's kicking off that work, and we work with the specialists in the area.
Yeah.
And it's a partnership program, so we've got, again, University of Melbourne, Australian Dental Association, Vic Branch, and La Trobe University involved.
Fantastic.
With funding from Department of Health.
And I think that's a really important part of the work that you and your team does, and it is that partnership model, because we can't do this all by ourselves.
No.
We actually do need to partner with the rest of the, I guess, those other people that are involved in treating and seeing patients, but also those who are involved in training and research and development, so that we're actually getting, as you say, best practice, and we've actually got this all as evidence-based. So
That's it. Yes.
fantastic work. So the final question, you've been at DHSV for a long time. How many years now?
Oh, too many, Sue. Too many to know.
What do you think is the future for DHSV, and what's got you excited?
Right. Well, I think we're on the right path. The strategic direction is all about prevention, and it's no surprise that I would be all for that, having worked in prevention for a very long time. I think it's great that there's a focus on child oral health, because that is somewhere where we can make the biggest difference, but also this early intervention and this early detection. And, you know, we've talked about oral cancer, but it's across the board. There are so many different things that, you know, prevention is better than cure. So, I think that, as you said, in partnership we can do so much more than by ourselves, and working outside of dental as well is important, because sometimes they are where the patients are going, and so if we can identify those at most risk and send them, you know, in and make that process easier, then that's a positive thing.
Excellent. Thank you, Suzanne, for spending the time and having a coffee catch up with me. I look forward to what your team is going to continue to do. You've done some amazing work over the time that I've been in DHSV, so I'm looking forward to that next step. And I agree, you know, in partnership, I think we're going to make a real difference, particularly with our new strategic direction, having that very clear prevention focus. I think is giving us a lot of, a lot of ability to actually move into that space even more. So thanks again for your time.
Thanks, Sue.